Kids do well if they can, but what if they can't? Sam's first 6 months of kindergarten were heartbreaking for her mum, Michelle. When Sam started school, she was unable to speak in sentences or take part in any class activities. She became withdrawn and wasn't making any friends. She really struggled to communicate with her teacher and her classmates, and she spent every morning crying that she didn't want to go to school. She was already behind, and school had only just started. For children like Sam, living in rural communities, this is not an unusual story. It might shock you to learn that children growing up in rural and remote Australia are twice as likely to be developmentally behind their city counterparts. Just imagine that. They're twice as likely. At Royal Far West, we believe that country kids should have the same chance as any city child does to reach their full potential. We know that the earlier these kids get the help, the more likely they are to catch up and to thrive. But without intervention, vulnerable children grow up to be vulnerable adults. This starts a vicious cycle because these adults are more likely to have children with developmental delays of their own, as well as poorer outcomes at school, employment, and higher rates of chronic disease and poor mental health. I'm sure you would agree, this inequity simply isn't fair. Watching a child struggle is a heartbreaking experience for any parent. But living in a rural community with limited services, it can feel incredibly, utterly isolating. Access to a health professional in the city is relatively easy. You can access someone, typically within a few kilometres from your home and get an appointment within a few weeks. For Michelle, however, to access a speech pathologist for Sam meant travelling a gruelling 200-kilometre round trip every week. Imagine being a single mum having to travel this distance every single week with a 6-year-old. It's simply not realistic or sustainable. Even if this was possible, on top of that, the cost of seeing a health professional can be upward of $160 per appointment, and waitlists are so long that Sam could be waiting months or even years to get that first appointment. Too many children can't access the care they need purely because of where they live. And the truth is, kids move along at a fast pace. And sadly, if you fall behind, you get left behind. Telecare for Kids gives us an incredible opportunity to bridge the divide between city and country kids. When Sam started school, her teacher was determined to give her the help they knew she needed. The school connected Sam with Telecare for Kids through Royal Far West. So what do? What does Telecare deliver? Since 2014, Telecare for Kids has delivered weekly online speech pathology, occupational therapy and psychology services directly into the child's home and their school. This meant that Sam could access much needed therapy at her school, removing that barrier of distance. It also meant Sam not only had access to a speech pathologist, but she could also access me, an occupational therapist. Now 2 health professionals to help Sam, give support to her mum, and all of this is provided at no additional cost to the family. Royal Far West's reach doesn't end with Sam. Sam's teachers were provided with resources and strategies to help Sam learn and thrive in the classroom. This empowered them to not only support Sam, but also the other children in their class that were also behind. With intervention, the changes can be profound for children like Sam. I spoke with Michelle recently and she was telling me that Sam is finally making friends, and recently she was invited to her first birthday party. This is something every parent wants for their child, but 6 months ago it felt unimaginable for the family. You can change the future for more children like Sam. Telecare for Kids currently services communities from Eden in the east to Fitzroy Valley in the west. We connect with over 150 schools nationally, and in 2020, we provided over 1,000 appointments each and every week that otherwise may have never been possible for children like Sam. But together, we can do more. With your help, we can reach more children, more schools, and more communities nationally.